Hello, and welcome to iTenv Healthcare Solutions webinar, Streamline Patient Intake Using Instant Medical History in NextGen. My name is Chelsea Grover, and I'm the Marketing Communications Manager for iTenv. Before we get started on today's webinar, I want to take a moment to explain the process for the presentation. First, I'd like to mention that this webinar will be recorded, and that we'll send out a copy of the slides along with the recording within the next week. Next, for those of you who aren't familiar with iTenv, I wanted to share a bit of who we are with you. We specialize specifically in next-gen healthcare, and we're passionate about providing solutions for our healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. To sum it up, we do everything next-gen. We also have add-on productivity solutions for next-gen, including ChartGuard, Refund Manager, Unapplied and Deposit Manager, and Multiple Encounter Billing Manager. Next, I wanted to mention an upcoming webinar topic that you can expect from us soon. On October 6th, we'll be presenting a deep dive into NextGen's patient experience platform. In it, we'll provide a thorough look at the features and functionality in the PXP Portal. Our goal for this webinar is to ensure that you are prepared for the NextGen PXP by knowing exactly what to expect and how to use this new tool to increase patient and clinician satisfaction. So keep your eyes out for an invitation to that webinar and follow us on LinkedIn to be the first to know about it. Okay, so back to today's webinar on streamlining patient intake using instant medical history in NextGen. At the end of the presentation, we'll open the floor up to questions from you. We'll answer all the questions at the end, but you can type them in the questions area of the webinar control panel whenever they occur to you. And finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions may be entered in the questions box. So, without further delay, I'd like to introduce our presenter for today. Lexi DeMarsh is Manager of Consultant Education and thus is in a great position to discuss today's webinar topic. So Lexi, take it away.
Thank you, Chelsea, and thank you to all of you for being here today as we explore how your practice can really streamline that patient intake process using instant medical history within your NextGen system. So for those of you who maybe were intrigued by the concept, or you know what instant medical history is, but you're really not familiar with it, I just wanted to start off kind of by explaining what this product is and what it can really do for you. So before we get too deep really into the details of what it is and how it works, I did want to kind of clarify the two ways that that acronym IMH, which you're going to hear me use a ton throughout this presentation, is used when we're talking about this feature. So the first is the name that NextGen uses to refer to the forms themselves. So those are called Interactive Medical History Forms, or IMH Forms. We also have the product that makes these forms possible and work in your NextGen system, and that is Instant Medical History, or IMH. So I know that seems like we're just setting you up for failure, but I promise it's just, IMH really, if you use that acronym, you're in the clear. People will know what you're talking about. So now what exactly are interactive medical history forms? So these forms are discrete, decision-based questionnaires that are sent to a patient electronically, and they're returned to the practice prior to the patient arriving in the office for their visit. So now there are really two key words that I want to emphasize from that definition. So the first is discrete. If you're not familiar with what that term means, essentially it just means that the data from these forms will flow into NextGen as actual data points on templates. So these are the templates that you are already using, so things like our intake template, SOAPs, histories. So that's different than a paper form, obviously, where the data that is filled out by a patient needs to then be transcribed, by a member of your clinical staff. The second part of that definition that I really want to highlight is the fact that these forms are decision-based. So our IMH forms are really not one size fits all. That's kind of the beauty of these forms. So based on the answers that a patient is providing as they're going along and filling it out, the questionnaire is either going to prompt the patient with additional questions, so to gather some more information, or if they say no or doesn't apply, it's going to move on to the next section of questions. So let's say, for example, you're using an IMH form to collect a patient's family history, and they state that there is a family history of cancer. Obviously, it's beneficial to know what types of cancer, maybe which family member. So there may be additional questions that are asked to gather that information. So these forms are powered by a product called IMH Discrete Medical Identifier, which is a product of a company called Primetime Medical. So NextGen has really worked with this company to fully integrate this product. So really from both the end user viewpoint, from within your practice, as well as the patient perspective, you really won't be able to tell the difference between IMH and NextGen, which I think is really cool. I did want to add just a small disclaimer before we continue on that there are IMH licenses that are going to be necessary to utilize this functionality. So if going through this presentation is something you're interested in or something you've been considering, I'd really just recommend reaching out to your account executive, and they can give you some more details about what that process would look like. So now that we've discussed the what of IMH, let's talk about the how. So as I mentioned on the previous slide, the instant medical history solution is really fully integrated into NextGen. The questionnaires that can be sent to patients to complete are configured in file maintenance for all practices within an enterprise. So we'll take a look at what that configuration looks like in a few later slides. There are several methods that a practice can use to get those IMH forms into the hands of your patient. So the first is you can include a link in appointment reminders, and that is going to take patients to a separate website that contains the IMH forms that you want them to complete. The benefit to this option is that the patient will really have plenty of time to complete that form prior to their visits. Let's say you have that appointment reminder, go out 5 days before, let's just say, that really gives them a lot of time to complete those forms instead of being in your waiting room. Another option we have is to send IMH forms directly to the patient portal. So I did want to note that this is a feature in the legacy NextMD portal, as well as it will continue to be a feature in the new PXP portal that's coming up with the spring release. So regardless of the version that you're on, you will have this functionality. So those IMH forms, when they are sent to the patient portal, they are delivered as a link in a secure message. If your practice is utilizing NextGen's virtual visit platform, there's also an option to incorporate these IMH forms into the check-in process. So the patient will go through their normal, virtual visit check-in process, and they will be prompted to complete a decision-based form in place of those standard virtual visit intake questions. So it's just another way to kind of gather some more information really specific to that patient's needs. And then finally, instant medical history can also be used directly in your office by giving the patient either a tablet or directing them to a kiosk in your waiting room to complete the necessary forms. So obviously this requires the patient to actually be physically in your office, so you do lose some of the benefit of having all that clinical data ahead of time, but it can still help reduce paper and also limit that time having to transcribe that data from a paper form into the patient's chart. So still some benefits with that. And really, with all those options I just mentioned, a practice can really use a combination of those. To find that solution that works best, for your organization and kind of how you run things, as well as for your specific patient population. What they would be most willing to, complete. They have access to computers, things like that. So once those IMH forms are submitted to the patient, so by any of those options we just discussed, once they are completed and then returned back, they're going to be pulled into your EHR application, as I mentioned, as discrete data. So that information is going to flow into the appropriate template on an encounter in the chart. So you can see some examples here of some of the templates that this information can flow onto. For example, if the patient filled out details regarding their surgical history, so that's going to flow onto our medical surgical history panel on our histories template. So there's a lot of different templates. I would say that this, the list is constantly changing because IMH forms are constantly changing. They're constantly adding new ones and adjusting them kind of for your, what the patients might need to supply for you. So it will flow directly onto the template where you need it. And then finally, once that patient's data has been added to the encounter, flowed into our templates, we will also see a summary document. That is going to be saved to the encounter as well, and it will be in PDF format. It basically just kind of gives you an overview of, you can see all the questions that were asked of the patient during that questionnaire. So you can refer back to that at any time. So now that we've kind of just given a brief overview just to catch everyone up so we're all on the same page, let's jump into the actual configuration that is involved in using the interactive medical history forms at your practice. So there are several areas that will need to be configured in order to use IMH Forms. So the first is the PXP Portal integration tool. So this is something, as the name implies, would only apply if you're going to be using the IMH Forms through the portal and you are using the new PXP Portal. So if both of those apply, then you will need to enable the instant medical history solution within that integration tool. The majority of the configuration beyond that will actually take place in file maintenance. So we will be using two different master files, so our online practice settings, as well as there is a specific interactive medical history master file. So we'll take a look at those steps here in just a few slides. And then finally, there is a security right that goes along with IMH Forms and System Administrator. And you can set those up for your individual security groups. And again, we'll see that here in a few slides. Okay, so our first step here in configuration, if we do want to be able to send those IMH forms through the PXP portal, you will log into what's called the PXP Portal integration tool. And we'll select that practice config option from our left column there and select the IMH tab. Here is where you will enter the IMH URL as well as the IMH key that's provided to you when you're going through your IMH licensing process. Once you have that saved, that is going to turn on the IMH feature for your PXP portal. The next step in configuration is to enable the interactive medical history functionality in our online practice settings master file. So this will apply for a lot of different methods for how you're going to send forms. It is done at the enterprise level and then would apply to all practices within that enterprise. So if you are a large organization and have multiple enterprises, you do theoretically have the option to only use IMH in certain enterprises. Again, keeping in mind though, it does apply for all of the practices. So on that properties tab of the enterprise settings here, we would check off that box for enable interactive medical history discrete. So that's going to turn on that functionality again for the entire enterprise. So there are thousands of questionnaires that are available from Instant Medical History. So obviously, for the sake of space and just for simplicity, they're not all going to be there automatically by default. Instead, what you can do is at the enterprise level, you can go into that interactive medical history master file, and you actually get to choose which forms you would personally use. So obviously this can be based on specialty or the age of your patient population. If you need pediatric forms, things like that. So basically, in order to use those forms that really capture the data that you want to capture, you will add them in that master file. So there's a link to add IMH discrete questionnaires. That's going to give you the window that you see here on the slide. You have the ability then to search, so by different keywords, and you can look for categories of forms. So for example, if you want the category of pediatrics, and it's going to show you all of the forms that are available for that specialty. Or you can search, you can see in this example, like more specifically, for different body areas or systems or however you'd like to search. And then you would go through and you would check off that available box for the forms that you want to save to be used by your practices. So then our next step after we have gone ahead and added those forms, we do have the ability to pull in new forms that are created by Instant Medical History. So as I just mentioned, there's thousands of questionnaires available, but that's constantly being updated. So in order to view those latest forms, when I'm on that same screen that I was just on to be able to search, there is a link that says check IMH discrete for new questionnaires. And in my screenshot here, that little bubble with an eye to the right of that link is actually letting me know that what I have currently available to me, there are new forms that I haven't downloaded yet. So that lets you know, and it'll actually connect you directly to IMH, and you can pull in those new questionnaires again as they're being updated or new options are available. So it's really going to look for those latest published questionnaires that are available. So a good idea to kind of check this periodically. As a great example, they added a COVID-19 screening form. That's something that a lot of people probably need. Maybe you want to screen patients before they come into your office. So that is something that's now available, and you could download that through this link. So after we have downloaded those IMH forms that your practice is planning on using, we can use the arrows at the bottom of this screenshot here on our configuration window to move those forms over from our available questionnaires, which is going to contain every questionnaire you've downloaded, to our questionnaires that can be sent to patients column. So by moving those over, we can either, again, select individual forms that you plan on using, or entire categories. So you can see in this example, we've moved over all of the pediatric forms. But again, you could kind of pick and choose and narrow that list down as well as needed. And then finally, as I mentioned, you do have the ability in System Administrator to limit which security groups are going to have the access to complete that configuration that we just mentioned. So, just like anything else, maybe you'd want to limit that to maybe like administrative roles. So that right can be found under the file maintenance category of our modules section of security rights. So being modules, we're going to have for that right the ability to add or remove access rights for view, add, update, delete, and then print. So that can kind of give you the ability to control who has access to that. So once we've configured those IMH forms that your organization will need, you can really start to utilize these forms to benefit your practice as well as your patient population. So one of the ways that the interactive medical history forms can be shared with patients, as I mentioned in the beginning, is through the portal. So again, that's either the legacy NextMD portal or the PXP portal. So these can be shared a few ways with patients. The first is through the patient portal menu that we find in the EHR. So this is the same functionality as if, to send forms through the NextMD portal. So we would go to our file menu within the EHR application. We would select patient portal and then select our interactive medical history and then send form. That's going to give me this window that I see here on the screen with all of the available forms. And then I can go ahead and check off the ones that I want to send to the patient. Another option for sending those IMH forms to the portal is to attach them to a portal message. So if a provider or clinical staff wants to send a message, maybe some additional instructions or some background to the patient, they can compose a message. From the EHR, we would do that from our patient portal tab in our inbox, and when we would click compose. And then on our patient portal message window, we have that attachments tab. Here we'll have an icon to add our interactive medical forms. So by clicking that, you'll see we'll get our add attachment window. And again, the same process, we could go through and we could select one or multiple forms to go ahead and send to the patient. You would then finish composing that message like you normally would, and then click Send in Chart. So that's going to send your message along with a link to complete the forms that you've attached. The process for sending forms from the practice management application is going to be pretty similar to EHR. So our portal messages, if you're not familiar in practice management, are composed through the NextGen mailbox. In the top right corner, I'd want to make sure that drop down, I have that selected as patient portal, and then I would click my new message button. So again, I would compose my message. I can add any details, instructions, and then on the attachments tab, again, I would select that add interactive medical forms icon and choose the form that I want from the list. So really it's pretty much the same process. It just depends on in which application the user is in that needs to send the message. If your practice does receive appointment requests through the portal, so again, this is either the legacy NextMD portal or the current PXP portal, when you're actually responding to those requests from patients, we do have an option to attach an IMH form to the message. So basically you would go through your normal process of searching for that available appointment. Once you've selected one for the patient and you're on the respond to patient window, you'll see there in the middle we'll have the ability to add again one or multiple IMH forms. Then you can go ahead and again attach a message to that if you maybe want to have them confirm the appointment and then complete the forms ahead of time, whatever details you would like to add. The patient is then going to receive that message like they normally would from that appointment request before that appointment takes place, and they can complete those forms. So you also have, from the patient perspective, several different ways they can receive that link. So obviously we can send them in different ways and it'll look a little different on the patient's end. So one of the popular options to be able to send and receive the link for IMH forms is actually through appointment reminders. So this is an example of what that would look like. You can add your own verbiage of what would go along with that link. You may be encouraging the patient to go ahead and complete that questionnaire to, in this example, to save time in the office. So then they would receive that link and then they can go ahead and complete the form. As we mentioned, patients can also receive that IMH form link through the portal. So here's an example of what that would look like. If it was sent to their portal, they would receive a secure message, and you can see it's asking me to fill out that IMH form, and then I would have that link to go ahead and complete it. As we mentioned, our instant medical history solution can also be integrated directly into that existing NextGen virtual visit platform. So basically from the patient's perspective, this is what it would look like during the check-in process for that virtual visit. If you've configured the IMH form, then the patient will be prompted to complete a series of intake questions. So this is kind of the same format as if you were just using those standard intake questions from virtual visit. But of course, these are going to be decision-based model. So it's going to prompt them based on their answers. And then that information would flow back into the chart. So they would complete those intake questions and then they would continue on their normal steps to go ahead and register for that virtual visit. So once those necessary interactive medical history forms are received by the patient, they really can begin completing those on their own time when it's convenient. So if I'm a patient, I come in here and I click on the link. This is typically the first screen that I'm going to see on the questionnaire. It's going to ask me just some basic demographic information from the patient. So they will be able to complete this, and then you'll be able to compare this information to what you currently have documented in the patient's chart. If the patient was sent multiple questionnaires, so I mentioned it's possible to send more than one at one time, before their visit, they will see them listed, like you can see in this example on the slide. So they can choose to complete all the forms at one time if they'd like to, or the beauty of this is that they can also come back to that link at any time in the future if they need to stop, and then they can complete those additional forms really on their own schedule. So as I mentioned, those questions on each form are really decision-based. So the number of questions and what specific information is asked of the patient is really going to depend on the patient's answers. So the benefit of if the answer is no or doesn't apply, they're not filling out a 4-page form. Again, it will stop and it'll move on to the next set of questions. So like in this example here, if the patient answers yes to the question of whether their doctor is treating them for high blood pressure as part of their diabetes treatment, then you might have some additional follow-up questions. So things like maybe what methods of treatment are being used, exercise, diet, medications, anything like that to kind of gather more information. Obviously, if the patient states no, they're not being treated for high blood pressure, then the questionnaire would move on to the next topic because there's no more information that needs to be collected. You can see also the patient does have the option to skip questions or go back to previous questions at any time if they would like to. So another benefit really of utilizing these IMH forms is the ability for the patient to really have control over when they complete the forms. So, like I mentioned, they have the ability to, complete all questionnaires at one time or come back. They also have the ability to leave a questionnaire at any time. So if they're in the middle of working on it and they have to step away, they can select that stop questionnaire option. It's going to exit out of the form, but it is going to keep their progress. So if they do have the ability, hopefully they go back in later and complete that form, they can just start over. Another option is the ability for a patient to be able to completely start over on a questionnaire from the beginning. So, maybe that questionnaire was for a well-check visit for, let's say, their oldest child, but, they start filling out the demographics and that diagnostic history, and they realize they're putting in the information of their youngest child. Instead of having to reach out to the practice and have to send them a new form, or anything like that, they can just click start over and they're going to be taken back to the beginning of that form and they can start completing it again. So again, just really the flexibility of these IMH forms is what makes them so valuable. Any obstacles we can remove for patients to be able to complete these really increases their chances of actually going ahead and completing those and then hopefully being more satisfied when they get to your office. So once the patient has reached the end of that IMH form, they are going to be presented with a report like the example you see here on the screen. So it's going to show them all of the information that they've entered. It's going to show them the questions they've answered, as well as any that they have skipped. So they can have the ability to go back and they can, answer those skipped questions. They can also, review those answers for accuracy. Before sending that information along to the practice. So, if the patient realizes, at this point that they've made a mistake or maybe accidentally skipped over a question and meant to come back to it, they do have the ability to go back and modify their answers. Once they are satisfied with everything they've answered, they can click next, and that will submit that completed form to your practice. If the patient does have a portal account, then they will see that link that we see on our second screenshot, which is a return to provider website. That's going to take them back to that portal homepage. And so then they can do, complete any other portal tasks if they want to look at additional links for forms, respond to messages, outstanding bills if your patient or if your practice has NextGen Pay enabled, things like that. So once those forms are submitted back to your practice, the data would be able to be viewed on the encounter. So the appropriate templates that go along with the data that was entered will be open on our encounter. Like we can see here in our example, our SOAP template. There is also an optional configuration that you can have a task generate when a completed form is returned. So if you would like to have that notification ahead of time, so maybe that task can go to the provider, so they can go ahead and they can review the information ahead of time, or maybe you have clinical staff or someone administrative who's keeping track of those. you can really choose who receives that task. As you can see, in this example, the patient documented their cough and their earache, and that has flowed onto our SOAP template under that reason for visit panel. So here we have an example of a questionnaire, and this question specifically is asking for data for history of President Ellis. So the sample question here are questions that will flow onto our GYN bleeding HPI template. So you can see based on those yes and no's that flowed onto our associated symptoms and pertinent negative section. In this example, the question is asking for the patient's current symptoms. So again, this can be really customized to the specific symptoms that you would ask for your specialty. And the answers provided by the patient are going to be visible in the appropriate review of systems template. So in this example, it flowed onto the ROS female template. Here we can see an example of a question that is asking for some specialty-specific surgical history from a patient. So again, there's a lot of different variations of these questionnaires, so you can really choose the one that is asking the questions for the histories that you're really interested in. So in this example, based on that patient's response that they had a shoulder arthroscopy surgery, that flowed into the medical, surgical, and interim panel of our histories template. In this example, we can see that the patient was asked to provide their biological family history. So in this example, they checked off asthma and depression. So we can see that that family history has flowed now onto our family history panel of our histories template. So again, it's flowing into really the area where you need to see that information. And then here we have an example of the patient being asked about their tobacco usage. So again, one of the examples I gave was social histories. So based on their response, additional questions could potentially be asked, maybe to require, that different information about, their usage and the type of tobacco, things like that. So again, because they selected yes, that information then flowed onto that social history panel on our histories template. So you can see there's a lot of different ways that these templates can really collect the information that you need and then place it where you need to see it. And then, as I mentioned, we also have that summary document, and that is going to be a summary of basically all of the questions that were asked of the patient. This is going to give us a little more detail. We can see things, like what questions were asked and what they reported, as well as what's beneficial here is we can see anything that they've denied. So if they were asked a specific question, like in this example, they reported COPD, but they denied asthma. So you can kind of get a better idea of what was asked and what exactly the patient reported. So as you can see, really the process, to send and receive that patient data through the instant medical history solution, it's pretty simple. It's pretty easy to set up and to get out to your patient. That configuration is pretty minimal. So there's really a lot of benefits to using this solution. So one of the first and probably the most obvious benefit to using IMH Forms is the ability to really simplify that check-in process. So obviously the title of our webinar today. So it's going to simplify it for both the front desk staff as well as the patients. The front desk staff, they have enough on their plates. They're already juggling, trying to check in patients, answering phones, keep the waiting room moving, any other tasks they're completing. So taking out that step of having to give the right forms to the right patients to fill out before they can get them back to the provider is really just going to make things a little easier. As well as from the patient side, like they would really appreciate not having to hurriedly fill out these forms while in the waiting room. You may be trying to wrangle a toddler, if you're at a well child visit, things like that. Another major benefit is the reduced amount of time that the patient needs to spend in the waiting room. So, I'm sure we can all agree there's nothing more frustrating than, arriving at your appointment on time, but still being stuck in that waiting room. And it's usually to no fault of the staff. They're just trying to juggle too much. So, removing the need to sit and have to fill out those forms can really be a big time saver. According to a study by Primetime Medical, it can save up to 4 minutes per patient. So you can imagine, if you're seeing 20, 30 patients a day, that really can add up. And then speaking of time saving, really the ability for the patients to complete these forms and submit that data before even having to step foot in your office is really going to allow providers the ability to take their time reviewing that information. Instead of having to quickly glance at that historical information and diagnostic details that the patient provided, they really can take the time to dig deep into what was documented, and then even maybe start to prepare for that visit ahead of time. Maybe kind of think of some of the steps that are going to be taken, because they potentially could get this information 3 days before the patient's visit. The ability to have that clinical data that is documented by the patient go directly into the templates, that is going to be a huge time saver for clinical staff, or whoever you typically have transcribe that information from a paper form. So instead of having to sit there and type it all in, that's time that can be spent getting that next patient out of the waiting room, sitting there actually having a conversation with the patient, more of that face-to-face time. And in addition to saving time, it's also really going to remove the risk of error that comes along with transcribing that clinical data from a patient form. Human error, it's something we can't avoid. While having a human eye to look over things is good, in a hectic office, especially if like double booked appointments, if they need to move quickly to enter that data, there's a good possibility that mistakes could happen or information could be missed. So putting it on the patient to actually enter the data themselves, and then it goes directly into the templates, can really remove that risk of error. And then, finally, if patients are able to complete any of these required forms at home, kind of at their own pace, you're really more likely to get a greater level of detail than if, the patient is sitting in that waiting room, HCTV is in the background, Joanna Gaines is on, I'm maybe not totally focused on my medical form you're having me fill out. But really, having them do that at their own pace at home, they can potentially also have access to past medical records, or be able to log into a portal for another provider or a hospital and really give you complete and accurate health picture instead of maybe just guessing or kind of running through it quickly. So really, as you can see, there's a ton of benefits to using this instant medical history solution. So hopefully you could see that it's something that's very easy to configure and really can help your practice a lot. So I hope that you can really walk away today with maybe a better understanding or maybe even some new ideas of how interactive medical history forms really can be incorporated into your practice and make your lives a little easier. That's really the goal for yourself and for your patient population. So with that, I'm going to turn it back over to Chelsea. She's going to talk a little bit about next steps, and then finally we'll open it up for any questions that you guys may have.
Okay, great. Thank you so much. I appreciate it, Lexi. So, next steps, if you're interested in learning more, you can always reach out to us directly, and we're happy to discuss it one-on-one with you, especially as it pertains to your specific practices. Otherwise, sign up for our websites, our blog, follow us on LinkedIn. We always do weekly tech tips and other assorted helpful things, especially that pertain directly to NextGen. And if you are interested in any of the stuff that I talked at the beginning of the webinar regarding what we do, different add-on products we have, including ChartGuard, Refund Manager, or if you want to learn about our 3-day fixed on-site consultations, feel free to drop us a note. We specialize with those in clinical workflow, revenue cycle and front office, and technology and performance. So basically, any area that you have questions on or might want some assistance with, feel free to let us know. I'm sure that we can help you. So back to the topic of today's webinar. If you have questions, feel free to type them in the questions area of the webinar control panel. We already received a couple of them, so we're going to go through them in the order that we received them. But if you have them, now's a great time to ask them. So the first one, I believe the person asking it figured out the answer, but I'm going to read it out loud because frequently when one person has the question, somebody else has it too. So first question, how are these forms sent to the patient before their appointment?
Okay, yeah, a quick note, I just realized we're using a slide from a past webinar.
Oh,
This is
sorry
not
about
my
that.
contact information. That was
But you can reach out to either one of those people and
correct,
they
and
will
they
get
can
it till
get you in
next week.
touch.
We all work very
So just
closely
as a
together.
note, but yeah, we talk daily. So just as a note on that. But anyways, back to the question. So yeah, I'm assuming just said maybe that was early on.
Yep.
Yeah, so a lot of different ways. Just to really summarize again, just appointment reminders. So if you do use like the EDI appointment reminder solution, you can have that link incorporated. They can be sent to the portal. So again, that's the legacy NextMD portal, the PXP portal as well. You can have those links incorporated into your virtual visit. So if you do use NextGen's virtual visit solution, that's an option as well. I believe I listed, oh, and then also the tablet and the kiosk. So you can have that set up directly in your office as well. So if you prefer, maybe you have a patient population that doesn't have a lot of access to computers or whatever the case may be, you can actually have them electronically fill out those forms, but while sitting in your office. So I believe.
Perfect. Thank you. Next question. How do the new questionnaires get added to IMH?
So the new questionnaires are published by that Instant Medical History, so that they are the ones who create the questionnaires and they publish them. So as they, kind of publish new questionnaires, maybe update or add new questions, as I mentioned on that one slide in that interactive medical history master file, there is that link to be able to check for new forms. And like I said, that if you remember that icon, which again, the slides will be sent out if you can't remember what I'm referring to, and it specifies it in there, but that icon will let you know basically if you have the latest or if you should go ahead and click that link and get the newest forms. So they are provided by that instant medical history solution.
Great, thank you. Next question. How does clinical staff know when a patient submits a completed form?
Yeah, it's a great question. So there is an option to configure a task. So if that's something that you'd want to do, again, you can choose either the provider to be receiving that task, or again, you can choose maybe clinical staff or administrator, office manager, whatever, whoever should receive that. And basically it would they'd receive a task, it would let them know that a form has been completed. And then again, they can go into that chart, they can view the discrete data on the templates as well as that summary document. So that's an option. Otherwise, I know some practices that use this, they will just, kind of have part of the process is they'll go in and look at maybe the next day's appointments and look at the encounters that way. So obviously it's a little more manual, but that's an option as well.
Okay, next question. Do the patients need a login to access the forms sent via link?
That is a great question, and actually something I may add to the slides because that is not something I thought of ahead of time. Because that is a great question. No, they do not. That's kind of the beauty of these IMH forms is it's really, there's no logins, there's no accounts they have to create. They just can directly click on that link. Obviously, the exception being if you're sending it through the portal, in order to receive that message to get to the link, they would need an account, but to actually access the IMH website and complete the form, no, there's no logins required.
Are the forms pre-populated with demographic information that already exists in the chart, or does the patient have to submit their demographic information for each time they fill out a form?
That's also a good question. So not every form will have the demographic information, but if they do, then it doesn't pre-populate from the chart. That is something they would go in and they would enter themselves. So yeah, so if they were sent multiple forms, they potentially could have to type that in a few times.
Great, thanks. Next question. Will this work with customized templates in EHR?
So it's a good question. Theoretically, yes. I say theoretically because it might take a little bit of, again, because it is a customized template, just to make sure that, all of the fields do match up. But I would say that that's something that might take a little bit more customization, but yes, I don't see why that couldn't be.
What if you don't have patient appointment reminders set up? Can you only send them through the portal?
So in that case, you would have to have a way to basically get them the link. So typically, I would say probably yes through the portal. Yeah, I would say that probably would be the main way that you would send those links then.
Okay, next question. Does it cost the clinic to maintain IMH?
So that is something that I can't answer. Unfortunately, I would love to give you an answer. It's not because I don't want to. It's because it really just depends on your particular organization. I would say that typically there might be some initial cost. Again, that's something I would recommend, reaching out to your account executive, and they can give you a more concrete answer for your particular case. So typically there's kind of an initial cost, but not reoccurring costs. But again, that is not set in stone. So I'd really recommend your account executive can be, exact answer on that for your particular case.
And by account executive or account manager, you mean your NextGen one, right?
Correct. Yes. Yep. Yes. NextGen account executive. Exactly.
Okay. Next question. Where'd it go? Does the patient have to return the form the same day as their appointment?
They don't actually. The goal is hopefully they do it ahead of time. So whenever they receive that, so again, just depending on when it's sent, they can kind of return it whenever. But no, it doesn't technically have to be the same day of the appointment.
Great. Can the forms be customized to meet the tech or to meet the clinic's needs?
So that is another piece that they are IMH, and again, when I'm saying IMH, I mean instant medical history. That is something they're constantly kind of working on. I would say there are some abilities, so you can select, pick and choose certain subsets of questions to kind of combine to make the form that you want. But as far as like complete customizations, like if you want a whole new question added, there's not really that functionality at this point. I will say they, again, are constantly improving on those, so it's a possibility that's something down the line, but currently you can't really create a completely custom question for your practice.
Okay, and it looks like this might be our last question, but we're going to hang on just in case people are still in the middle of typing or if they're like, oh my gosh, now's my chance. So I'm going to go ahead and read it, and if you have a question, feel free to type it in. Presumably, the patient does not need demographics entered and the chart created prior to sending the link, so the data has somewhere to go into NextGen, correct? Does need,
Yes,
sorry, does
they
need.
do need. Yep, exactly. Yes, they do need to have, a chart exactly for that, information to be able to flow onto the chart.
So
Yep,
it wouldn't be
that's
for a brand new, not existing patient
correct.
in the system.
Probably not, especially if, I mean, again, it would just depend on your practice and your workflows. I know a lot of practices don't like to create that chart ahead of time. If the patient doesn't show, I definitely understand that. So in that case, yeah, potentially this wouldn't work for new patients because yes, you do need that chart for that data to have somewhere to flow into. That's a great question.
Okay, we got another one. Who's the best person to follow up with? I'm very interested.
Awesome, I love that. I would say that, yeah, if you can reach out to, again, your NextGen account executive, they would be the best person to kind of give you, again, they can really give you specifics to your individual practice and kind of next steps, as well as if you do have any specific questions or have trouble, finding more information, again, you can say reach out to me, but we forgot to change the contact. So you can reach out to, I'd say, either Lindsay or Holland, and they will definitely forward that along if you're having any trouble getting information. And I would love to help you to get you guys connected.
And you can also always reply back to the email that I'll be sending as well with a link to the slides and the recording, and I'll get everything sent over to Lexi as well. So basically, any way you can get a hold of anybody, we'll get it to Lexi.
Yes.
Looks like we have another question. The information will be hidden until the chart is created.
So I'm assuming your question is asking if there wasn't a chart created. And so in that case, these messages are flowing, if the data that's coming from the form is coming through, I keep wanting to say Rosetta Holding Tank, old habits die hard, the clinical message manager, that's what I'm gonna have trouble getting used to saying. But regardless of what you call it, that is where just like a lot of our, HL7 messages, it comes through that. So if theoretically there wasn't a chart created, and so obviously, just like anything else that comes through, that holding tank, if it can't be assigned, then it would be in that holding tank for you to assign at a later time. So yeah, theoretically, if there wasn't a chart, it wouldn't necessarily be lost. It would just be there waiting to be matched to the patient. I believe that was the question.
And I do want to mention regarding the previous question, as far as who to reach out to, if you get NextGen through us, then you would reach out to us, right, Lexi?
Correct, yes. Yep, that's a great point.
Okay, another question. Can we text the link through a different system, such as our voice over IP phones?
That is a great question. I don't see why not. That is something I would have to just double check. So we'll have your information attached to the question, so I can verify that and get back to you just for sure. I mean, the links really are flexible in how you use them. It would just be, the connectivity, to the specific system that you're using. So maybe if you wouldn't mind following up with the specifics of the system that you use, and then I can get you a more definitive answer on that.
We had somebody requesting your contact information, so I did drop Lexi's email into the questions window. If you can see it down at the bottom, it's LDEMARSH at itentive.com, and your phone number is
It
Lexi.
is. That's a
Oh
great
no.
question. I know. I need to look. It's the worst, but I don't usually call myself. It is 224-220-5521. So again, that was 224-220-5521. I was gonna guess, but I didn't want to be wrong. So there's address books these days, built in.
Will we have access to this webinar later? Yes, absolutely. I will get this uploaded onto our website, and then I'll also send out an email with a link to the website and along with a PDF of the slides. That way you can access all this information later. We will update the slides to have the correct contact information. So you'll also have Lexi's info in there. And it looks like I'm guessing this is another follow-up in response to the previous question about the voice over IP. Is it's Citricom?
Okay. Yep. I will follow up on that and let you know.
Okay, perfect. Well, thank you everybody for joining us today. I really appreciate it. I know that everybody's schedules are busy. I hope that this webinar was informative and helpful, and we look forward to sharing more with you in the future.
Yes. Thank you, everyone.
Have a great day.